in now, and we'll give it maybe another minute, and then we'll get started with our intro. All right, hello everyone. For those of you who don't know me, my name is Zach Bernston. I'm a member of the communications team at Palladium. And good morning and good afternoon, wherever you might be calling in from. Thank you so much for joining. We're delighted to have you for today's webinar entitled Improving Health Outcomes by Delivering the Right Support to Private Health Startups. And so before I hand the table over to my colleague Steph to run and give a proper introduction, I just wanted to lay out a couple of things on the logistics side of things to let everyone know how this is going to run and how we're going to sort of logistically go through the steps for this Teams webinar. And thanks again for everyone for joining. So first of all, as some of you might have just seen, we are going to be recording this session, and after the meeting is over in the next coming days, weeks, etc., we're going to be not only sharing the recording from the session, but also I will actually be going in and pulling some clips and making some shorter videos that are more digestible for people and be sharing them widely on social media and otherwise. So look out for those in the coming weeks. I also wanted to just note very quickly that there's going to be a Q&A session towards the end of the webinar for those who are able to stay on until the end, which is at 11 a.m. Eastern. And for this Q&A, we have a chat function that you'll see in the top right corner of your screen for those who aren't as familiar with the Teams format. And then there's also an ability for you to raise your hand during this Q&A session. So for those who don't know Teams very well, on your top sort of bar on the top of your screen, you'll see a button for reactions, and under there you'll see a hand button. So if you hit that during the Q&A session, you will be, essentially virtually raising your hand, and we'll be able to call on you for your question. So we really look forward to that interactive Q&A session towards the end. A couple of other quick logistical things before I pass it off. As you all know, we've been hosting virtual webinars for a couple of years now, on and off. So you're all very familiar with the sort of best practices of keeping yourself muted when you're not speaking, and for those who are speaking during this presentation, when it's not your section of the presentation on our agenda, you'll go ahead and want to keep your mics off and your cameras off to allow for sort of best transitions and the best possible use of the technology. And with that being said, we're so happy to have all of you on. Thanks for joining. And I'm going to go ahead and pass it over to my colleague, Stephanie Gallagher, who will give a more proper introduction to the themes and the agenda of this presentation.
Okay, great. Thanks so much, Zach. And good morning, afternoon, and evening to everyone joining. Thank you for being here today for a panel discussion on supporting private health startups in low and middle income countries. In recognition of the recently observed International Day of Action for Women's Health on May 28th, we're especially excited to welcome Kasha and Sehat Kahani as our featured health enterprises, both of which are women-founded, led, and owned businesses focused on improving women's health. Before we review the agenda for today's discussion and introduce the speakers, though, it's also my pleasure to alert you to a forthcoming brief on this topic. In this brief, we will share, which we will share with the recording of today's webinar at a later date, we seek to provide more detail and depth on the key topics and discussion points from today, namely the importance of delivering the right combination of business development services and financing support to health enterprises in their startup phase. We hope that you'll check it out and it will serve as a useful reference for your work going forward. So with that, let's get started. Here's our agenda for today. I'll start by introducing our speakers in just a moment, which will also outline the flow of today's discussion, as you see here. After our speakers present and discuss, there will be time for you all to engage directly through a moderated question and answer session, and we encourage you to use your raise the hand function as Zach just outlined. So we can unmute you and you can ask your questions directly to the speakers. Or if you prefer, you can use the chat function and type your question in there, which we'll be following up on as well. So let's meet the speakers. First, I'm Stephanie Gallagher. It's my pleasure to be moderating this exciting and timely discussion today. I'm a senior technical advisor for private sector engagement within Palladium's global health practice. I currently support a range of USAID bilateral and global projects to increase private sector engagement for health. I bring over 15 years direct implementation experience in market development for health across Africa and Asia. Prior to joining Palladium in 2021, I was with Population Services International for 12 years, where I held a range of project and regional management and leadership roles focused on expanding access to sexual and reproductive health, malaria and child survival services, and commodities. Just a few moments, it's my pleasure to welcome Sylvia Boulos, who will provide today's opening remarks and frame our discussion. Sylvia is a market access and innovative financing advisor in the Center for Innovation and Impact in the Global Health Bureau at USAID. She focuses on market shaping and financing efforts to accelerate the introduction and scale up of innovative global health products and services across disease areas. She also works on CII's efforts to help scale up private sector engagement. Prior to joining CII, Sylvia worked at the World Bank, Inter-American Development Bank, and other multilateral development agencies. Welcome, Sylvia. Following her remarks, we'll hear from Natasha Mugeni, Kasha's Regional Health and Grants Manager. Natasha is a public health professional and sexual and reproductive health rights advocate with more than 6 years of experience in managing health projects, programs, and conducting research in East Africa. At Kasha, she leads and implements community-based interventions, clinical programs, research projects, and digital health solutions. She has experience in managing public, private, and donor partnerships. Natasha will then be joined by Robert Haney, former CEO of the Spring Accelerator, who provided startup phase support to Kasha. Robert has nearly 20 years of experience in economic growth and social enterprise development, focused mainly in low and middle income countries. Currently supporting FMO, the Dutch Entrepreneurial Development Bank, by leading on the Ventures program, ecosystem building efforts. As the former CEO of Spring Accelerator, plus several years as a U.S. government diplomat and development expert, Robert has expertise in structuring and managing blended finance mechanisms that align development and commercial capital to achieve mutually aligned objectives. Robert is also an adjunct professor with Georgetown University, leading an executive master's class in social impact and strategic communications. And he is a member of the Innovation Advisory Board for Unleash Plus, helping with the pre-accelerator program. Welcome, Natasha and Robert. After their discussion regarding Kasha, we'll pivot to hear from Sehat Kahani. Dr. Sarah Saeed Karam has over 7 years of experience in the field of digital health care as the co-founder and chief executive officer of Sehat Kahani. Previous to this role, Dr. Sarah was a clinician training for a career in radiology and has also worked in microhealth insurance and community healthcare initiatives with USAID. She has won notable awards for her work, such as the 2019 Associate Laureate Rolex Award, the Unilever Sustainable Living Young Entrepreneurs Award, and the 2016 UNICEF Global Goal Campaigner Award. She has also held multiple fellowships, including with the Malago Foundation, Cartier, and Acumen. She has been a TEDx speaker and spoken at multiple events focused on digital health startups and entrepreneurship, led by Microsoft and Google, among others. Finally, Dr. Sarah will be joined by Jonathan Abewick-Rayma of IIX. Jonathan is a fund management, treasury, and investment banking expert with 8+ years of impact investing and development banking experience, and with a passion to impact the world positively through finance. At IIX, Jonathan is the Vice President of Impact Partners, leading the company's corporate finance work, assisting impact enterprises globally to raise capital through debt and equity. Prior to IIX, Jonathan headed the investments team at Lanka Impact Investing Network, leading investments in impact enterprises in Sri Lanka. Jonathan set up the investment banking unit at the second largest private commercial bank in Sri Lanka, Hatton National Bank, where he has extensive experience in capital markets, treasury, and global markets. Jonathan has also co-founded 2 startups and made 1 successful exit. He is a global shaper representing the Colombo Hub at an initiative of the World Economic Forum. So welcome to all our speakers. Thank you so much for being here today with us. We're really excited to hear more about the discussion. And with that, I will pass it over to Sylvia to get us started. Thanks, Sylvia, and welcome.
Yes, thank you, Stephanie, and good morning, everybody. So my name is Sylvia, and I am a market access advisor on the market access team, as Stephanie said, on the Center for Innovation and Impact team at USAID. So at CII, we are very much a cross-cutting team that's invested in the blended finance space and how it can be used to address the global health challenges that we face. We have funded a number of initiatives to drive innovation and scale in areas such as maternal and newborn health, and also in the area of combating outbreaks like Zika. We developed and published a key foundational resource called the Blended Finance Roadmap to lay out pathways to understand where and how blended finance can play a role in crowding in private investments in the health market. However, despite those examples of successes, we know that there's a number of opportunities that require greater private investments in order for them to scale and create the impact that we as a global health community would like to have. So the global health community has made undeniable progress on a number of health indicators, reducing maternal mortality by 44%. The global under 5 mortality rate has declined by over 40% as well since 2000, and other numerous triumphs. While this progress is impressive, it is also clear that reaching our health goals will require far greater financing, especially private capital, with financing not just for existing interventions, but also for continued innovation in new enterprises. I'm sure everyone here is familiar with the development financing gap that we are facing, and it still is staggering to see when we look at the numbers and visualize what we are facing. And with more than $4 trillion in financing gap ahead of us, with official development assistance making up a very small percentage of that, close to 4%, we are trying to set the stage and figure out how to engage private capital and other resources to come in and meet that gap of 96% that ODA is not going to reach. The financing gap is really preventing us from achieving the SDGs and really reaching the full potential in populations across the countries in which we work, and that lack access to crucial health services and products. However, greater financing alone, although desperately needed, will not solve these problems. It will need to be coupled with greater resources directed towards innovation and scaling those innovations so that they can reach millions of lives. It will need to be coupled with the right technical assistance and private sector approaches to scale. Health enterprises have proven a variety of effective business models to address gaps in existing health markets and achieve health impact, but we need more support to scale solutions, particularly in low to middle income countries. Health market innovators and enterprises can be private clinics, pharmacy networks, digital health solution providers, or pharmaceutical manufacturers. And despite knowing that health entrepreneurs fill and address those gaps in the health markets with the various roles that they can play, not enough promising enterprises are reaching a point of minimum commercial viability. Blended finance mechanisms and approaches are available and can meet the financial needs of the health enterprises, and if successful, ensure financial sustainability with health impact. The different kinds of access to capital helps enterprises move from an idea to a startup to a sustainable business. An example of a blended finance tool being used on is in an activity that I lead in Tanzania. I help lead. A hospital network faced a shortage of capital funds by way of delays in receivables, and this directly impacted their ability to buy supplies and pay salaries to staff. They also faced limited financial management and business skills, which affected the ability to be efficient in demand planning and record maintenance. This hospital network cannot access formal lending sources, and this is why the creativity of innovative financing is crucial. We performed due diligence on which financial vehicle would best serve this hospital network, which provides over 40% of access to health to rural areas, and designed a revolving loan fund and invoice discounted mode of lending. This is also coupled with the technical assistance and trainings focused on financial management and operational excellence. In fact, the adherence to trainings is directly linked to eligibility for loans. So this will be piloted to 12 to 15 hospitals, and if successful, it will be scaled to a full launch. The blended financing bid comes from catalytic grants to subsidize fund operations and help mitigate finance costs, and the provision of a partial first loss guarantee to de-risk the participation from social investors. This webinar is happening for us to set the stage around this conversation. This is why CII at USAID is excited about it and very much in support of it. We are looking at 2 health private sector entities formerly supported by donor grant funding and now blended capital investment in the technical assistance they receive, and present perspectives about the causes of this success and lessons about the design of future initiatives. So thank you for attending and participating. I think we are all very excited to hear about and from the different panelists. I'll hand it over to Stephanie now.
Okay, great. Thank you so much, Sylvia, for those excellent remarks. We really appreciate you being here and your support. So at this moment, I'd love to invite Natasha to turn on her camera and her mic and join us for a conversation to present Kasha, and then be joined by Robert for a discussion on the Spring Accelerator support to Kasha in their startup phase. Natasha, over to you.
Thank you so much, Stephanie. As you mentioned, my name is Natasha, and I'm representing Kasha. And we're really grateful and happy to be in this webinar, especially this panel. So Kasha is a femtech platform with online and offline models that seeks to democratize access to women's health and personal care products. So our solution was built with a focus on women aiming to overcome issues of social stigma in accessing health products, such as contraceptives and menstrual care products like sanitary pads. We've been operating since 2016. We started in Rwanda and expanded to Kenya. We are now operational in 39 counties in Kenya and all provinces in Rwanda. So our solution enables women in urban and rural areas in Rwanda and Kenya to use any basic mobile phone and confidentially order their products. We do conduct last mile deliveries in urban and rural settings. And in rural settings, we use a network of agents. These are mostly women. So they can reach out to other women, but also really do the last mile delivery at the bottom of the pyramid. We also use our platform to generate consumer insight and behavior, but also understanding in depth our model. So we have worked with different companies like Unilever, JSK, Johnson & Johnson, MasterCard Foundation, but also donors like Bill and Melinda Gates Foundation and Packard Foundations. And in our early stage, we also did an amazing program that actually supported our work, the Spring Accelerator program. Next slide, please. So our 3 core pillars is access to product, access to information, but also improving livelihoods of women. And so our agent model do provide opportunities to women to actually be able to generate income. So they are being paid based on information. And we have amazing success stories from these women and how these have changed their lives, but also improved their livelihood. So all those core pillars have really different partners and supporters. And to ensure that we improve and ensure access and expand, we have different donors and investors and pharmacies and partners and clinic partners. And the clinic partners are really key because as a solution that also want to provide holistic care, we need referrals, but also need to have really proper products that we provide to our consumers. Next slide, please. So some of the amazing projects that actually currently Kasha is working on, and this one is a digital tool, and this is to improve access to contraceptives information, but also choices. So it has 3 main parts. It has the contraceptive forum, which allows women to be able to chat and discuss about SRHR, including contraception. But also it has the nurse chat where they can easily reach out to a nurse. And they have the contraceptive section too, which helps them to get suggestions based on their preferences. And this was supported by the Bill and Melinda Gates Foundation. Next slide, please. So on this slide, you see a picture of one of the offline activity where with our agent, we raise awareness and we support the clinics. We can do mobile clinics and testing and education sessions. As I mentioned a bit earlier, one of the key programs that actually laid the foundation for us was the the accelerator, the student accelerator program. And this program has been supported us to actually integrate the agent model. And this is really now one of the main sources of consumer acquisition and revenue of Kasha. But also it supported us in understanding from communities and women and girls in the communities what they need in terms of products and how do they need them. Even though we knew that the needs was there, we knew that our solution was gonna be there, but it wasn't turning into sales. We're just putting the platform there, but we couldn't see the sales and people coming to buy the products, and that's what the program actually contributed to Kasha. So I think we hear more from Robert on the program itself. So I'll invite Robert to share what is the Spring Accelerator program. Robert, over to you.
Thanks, Natasha. Yeah, I just want to explain a little bit about Spring Accelerator and then jump back to, we'll hear more and chat more with Natasha about how Kasha has really brought our mission to life. That was the mission of Spring Accelerator, it being a donor-funded social enterprise accelerator. So we were a 5-year program funded by several donors, and it was basically an experiment to work with businesses to help them create products and services to empower adolescent girls and young women, but really doing that through a human-centered design approach, so that you could help companies really implement and work with their end users and beneficiaries to understand what was needed through the products and services that they could bring to market. And we had a very modest goal of reaching 200,000 girls, but we definitely exceeded that in the end. In 2019, when we wound down the program, reaching over 1 million. The next slide. This is just to give you a sense of the range of businesses that we worked with, cutting across various sectors on the left side of your screen, for-profit, nonprofit models, really more early and early growth stage companies. And then these impact pathways are really about how we thought about and segmented the businesses that we worked with, because again, this was about working ultimately to impact the lives of girls and women, and how did it impact their lives, but yet then you had to kind of bring that through to, well, what was the service and delivery model and product that you brought to bear? So yeah, next slide was really, we did that through this process, which is here as a kind of linear map, if you will, but it was very much circular and iterative, as is such with human-centered design, and really taking a human-centered approach to what we did. We'd start by doing in-depth kind of mapping and understanding of the issues that girls and women faced in the countries where we operated. That was 9 countries across East Africa and South Asia. And then bringing the cohort of 12 to 16 businesses together each time for a really intense 2-week boot camp to hone in on what was their prototype that we would be working with them on. And that could sometimes be how they were pivoting their core business to really engage women and girls, or perhaps starting kind of an outcrop, a new line of business that was targeting this user group. And then we would support them through our donor funds to do in-market human-centered research. And this is what I think was a real unique value add for Spring, where we had the funding and could enable the businesses to take the time and have the resources to go to market, oftentimes with a third-party researcher, to collect that data through focus groups, et cetera, and then bring that back to the businesses, to Spring and the various experts that we brought to bear on that process to help them understand how to integrate that into their service. And then near the end of that process, bring them back to physically another 2-week boot camp to kind of continue to iterate on that and think about the go-to-market strategy and really then bring that prototype to life, and then support them to engage follow-on capital, which I think was really the kind of blended model that Spring represented, bringing in the donor capital to allow them to double down on the impact and the underserved community of women and girls, which they were focused on, and then hone in on a business model and engage more traditional investors to continue to scale. And so, yeah, with that, I would just like to circle back to Natasha, because of course, they were one of the most successful businesses that we continue to see scale and grow and market. And I think it was a learning curve for all of us in working with them. And so maybe we could just hear a little bit more from Natasha. If you could, you mentioned this kind of agent model, which was what we as Spring helped you develop. And maybe if you could elaborate on that, like what was the process and that realization that brought to bear this kind of new tweak in your model of bringing agents on board?
Thank you so much, Robert. I think going back to actually what was the issue is that the customer interest was not translating into purchases. And despite us knowing that there was a huge need for the services in Rwanda at that time, but we weren't seeing the sales that much. And we had so many visitors on our platform, for example, on the UCC platform, but then they went really without making a purchase. So what the program did is that we did a rapid prototyping to really identify what is happening, but also did focus on discussion. And one of the things we saw is that consumers were unfamiliar and untrusting of the e-commerce platforms. And so customers needed to interact with the products. They need to see the brand. But also they need trusted salespeople to feel confident and really secure to actually make the purchases where they don't see the product. So they really couldn't ask technology to do too much. So what we did was to understand now that actually we need salespeople in the communities, and that's how the agent model came in. And really, when you look at now where Kasha is, we have seen impressive customer growth in both online and offline, and significant headway with low-income customers, and the trust was built. And we have seen an uplift in sales and even in sexual and reproductive health products, which was our initial mission, and it's coming full circle. So, yeah.
Yeah, it's interesting. And so maybe if I can just recap what you were saying, it came down to that trust factor, right? Where you were saying your online kind of users on your platform were not converting into actual paying customers, but what was the issue there? And that's again what helped you uncover by being able to bring resources to you, right? Those human-centered researchers that would go to market and interview women and girls and really kind of uncover what that issue was. And then the way in which we kind of synthesized that at the end of Spring was that as we start to see trends across the space with a lot of tech-enabled or tech business models, such as yourself, that sometimes it's about perhaps not leaning into the tech solution, but what is the actual people-focused solution, right? So not expecting technology to do too much for you, but to really go out and engage your user base and bring that understanding back into your model. So yeah, it's really interesting to hear. And so maybe just a little bit more to kind of keep maybe going back in time, if you will, on those challenges that Kasha was facing at that moment when you started working with Spring, because you were at a very early stage. And you, obviously, as a lot of early stage ventures are struggling at that time, what were some of those challenges that motivated you to start working with Spring?
So one of the things that I think motivated us definitely was to understand, because we could see that there is a gap between what we intentionally thought it was going to be and what we're seeing on the ground. But also most of the support and grants and investors, most of the time also we look at the numbers. So how many have we reached, for example? And us struggling, so we are struggling in both ways. We are not getting our customer base. but also we're not able to even raise funds and investment to actually scale our business. So I think the program really was an eye-opening for us because it showed us that, like you mentioned, it's not about only technology, it's also about how do we engage actually the consumer on the ground and what they need to see, but also the products they might need. Because one of the things we realized in the program was that the focus on sexual reproductive products was amazing, but then people also needed beauty products. Women needed to see also other products, and that also changed the diversity of the products we were providing. So I think it went from even change in terms of what product we focus on. So it changed even who do we hire, who do we put on a team, and what will be the target for the new investment.
Yeah, that's interesting. And I think you're speaking to really the theme of this webinar, right? It's about the kind of range of business development support services that you needed, but obviously we're trying to get access and we're just hustling as a startup and trying to focus on scaling your business, but at the same time trying to synthesize, well, what is the BDS that you needed? And yeah, so maybe then just to kind of round it out here, thinking about that, it kind of more of a macro level, right? Like, what were some of those resources that were not available for you at that early stage? And perhaps maybe what has changed a little bit since, of course, you're now, what, 4 or 5 years, 6 years and successfully scaling, and those dynamics continue to change on the ground. So yeah, if you could just elaborate to wrap this up, that'd be great.
I think in the start there were not so many resources, and the thing was that even the idea of being able to understand in depth what the customer needs, what the program did actually, I think not most of investors and donors invest in that. And so that was one of the challenges, because even though we wanted to know, but we didn't at that time knew how now do we get someone to support, because those are financial resources that we need. The HCP work was costly. It's a costly work. And so we need those resources. So financial resources was, I think, a really huge challenge. But I think, yes, it has changed through the years. We started only at that time. I think on our early stage, there was the program, but we also had supported, we've been supported by angel and impact investors. But as we have grown, we have shifted to commercial investors and corporate strategic investors. And that's something that we're interested in working with. We have worked in donors and we're interested in donors, but I think looking at now what we're doing, we find it working with donors as a service partner than a grantee is more sustainable. And so as we continue to grow and scale, we'll be having also a focus on commercial investors. Yeah. Thanks.
Yeah, thanks. And maybe if I could just add a bit there to say, because I understand the balance that you and entities have to make in terms of working with donors and the amount of time and resources that can sometimes take. And then what I like to believe and see the value of mechanisms such as Spring and what are now we're seeing as other blended finance mechanisms, whether they be accelerators or funds or, can call them different things, but, that is the value of what I think these intermediaries can provide. So yeah, with that, maybe we'll just leave it there. I see we have a question in the chat, but I'll defer to Stephanie and team on if we're able to take that now or later. But Natasha, thank you. I definitely would like to talk more about that trust realization issue, which is an interesting one. But yeah, thanks for your insights today. Over to you, Stephanie.
All right, great. Yeah, thank you both. And thank you for the question already in the chat. We are going to pivot now to Sehat Kahani and give them a chance with IIX to share their story, but keep your questions coming and we'll be sure to return to this. So Robert and Natasha, don't go far, more from you to come. So with that, Dr. Sarah, please, over to you. Thank you.
Thank you, everyone. Just a sound check if you can hear me fine. Okay, perfect. So hi, my name is Dr. Sarah Sehat Kahani, and I'm the co-founder and CEO of Sehat Kahani. Sehat Kahani means story of health, and I'm so delighted to be here presenting my work. Sehat Kahani is a female-led health tech enterprise based out of Pakistan. It's created by me and my co-founder, both are medical doctors. Between us, we share a 14-year plus experience in telemedicine, public health, and community health. But more than myself, I'm a medical doctor. I was a radiologist in my past life. I have done my post-graduation in public health, and I'm very extremely passionate about how technology can change primary healthcare future in a country like Pakistan, which made the major healthcare challenges. So over to the next slide. So I just want to begin by stating the problem or what Sehat Kahani is working on and why it was created. So training as a medical doctor out of Pakistan, I saw two very interesting and contrasting healthcare issues in Pakistan, and they have to do a lot with the demand and the supply gap. So if you talk about the demand in healthcare in the country, Pakistan is the fifth largest population in the world. There are 220 million people in Pakistan. And interestingly, or unfortunately, 50% of these people never get to see a doctor in their lifetime, which means they might be seeing a quack or a midwife, but they don't see an actual doctor and get qualified healthcare. Very interestingly, in the same country, almost the same population has access to smartphones, and 80% of our population has access to a feature phone through simple mobile connection. But what connects me more to my company comes in the next slide, if we can change, is that Pakistan has a very unique case of missing doctors. So for 220 million people, we have 245,000 doctors, which means we have one doctor for 1,000 patients, which is the minimum WHO standard, still acceptable. But training as a female doctor, I realized in my medical college that 80% of my class and all classes of medical students are female. It's a very noble profession in Pakistan to be. And women want to do it because it gets you a noble stature in society, but also gets you a best hand in marriage, something that we call the doctor brides in our country. So a lot of women become doctors in Pakistan, but unfortunately, because of socio-cultural pressures, these women never end up working. They get stuck between graduation and practice. And that's why a lot of female doctors opt out of the profession. So out of the 80% that we have of the total workforce, only 40% practice. And additionally, a lot of doctors go out of the country for better work opportunities in countries like US, UK, Europe. So in actuality, we have half a doctor for 1,000 patients. And that creates a definite mismatch for doctors and patients in Pakistan, which affects more prominently the rural areas, the low-income areas, and women and children and elderly, which are more deprived and in need of healthcare. Next slide. But because it's a large population, the total addressable market of healthcare in Pakistan, particularly with primary healthcare, is huge. So we've calculated that the total addressable market for primary healthcare in Pakistan, even if we take the top 8 or 10 diseases for which a patient goes to a doctor again and again in outpatient or outside the hospital services, that calculates to be about 51 billion. And if we take some international telemedicine examples, then we believe that at least 23 billion of that can be serviced through technology. And when you connect a doctor to a patient via technology, the popular name for it is telemedicine, which is exactly what Sehat Kahani does. So next slide. So what Sehat Kahani does is we've created a network of predominantly female doctors and includes a large network of previously home-based and out-of-work doctors. And we connect them to patients in need using a chat audio video enabled digital health tech platform. It allows a patient to consult in real time with a doctor. The biggest USP of the platform that I personally love is that we have the ability to connect a patient to a doctor in less than 60 seconds, which creates an instant consultation option. But the patient can also book their lab, they can book their pharmacy, and they can be referred for tertiary healthcare. It is a very convenient two-click platform. Next slide. And we've always kept a very multi-population approach while building Sehat Kahani. Why I tell you this is because Pakistan's 70% of the population lives in rural areas. And most of these people don't have access to smartphones. So for traditional users who don't have access to smartphones yet in the country, we have created e-clinics. These are clinics in low-income areas where nurses are sitting physically. When a patient walks in, the nurse connects the patient to an online female doctor The doctor can be anywhere in the world, the patient is in the community, and creates a virtual connection. The patient also has access to a lab, pharmacy services, and tertiary care referral services in the clinic. For mobile users or urban users, we have a mobile application that allows any patient directly to connect to a user. So if I have a smartphone, I can connect to any doctor on the platform, again, in less than 60 seconds or by appointment. Our mobile application services two kinds of customers today. So we have individual consumers, so people like you and me can download the application. But in the previous slide, I also showed that there's a large corporate market in Pakistan for which outpatient services is negligible. Out of the total corporate insurance that happens in Pakistan today, less than 2% covers outpatient coverage. So we also have a corporate application that allows corporate employees and their families to have outpatient consultations through Sehat Kahani. And in this way, we very uniquely cover three kinds of customers in Pakistan: the low-income beneficiaries, the corporate users, and the individual consumers. Next slide. So over the years, we've been successful to create a network of 7,000 doctors. 90% of our doctors are female. 81% are in Pakistan, but 19% are globally. And much of this global growth happened post-COVID when a lot of global Pakistani diaspora doctors joined us to serve Pakistan and also earn an income for themselves. Very interestingly, a doctor on a Sehat Kahani platform ends up earning what they would earn in a physical practice in Pakistan, minus the petrol and the other expenses that they would have to bear. So a GP can make up to $700 monthly on our platform, and a specialist can make up to $1,800. And we now have 40 plus specialities present on the platform, ranging from primary care to early secondary care. Next slide. So if I talk about the total impact of the company, we've been active since the last 5 years. We were launched in 2017, and for 2 years, we ran our network of clinics, and we launched our app in 2019. So Sehat Kahani today holds the largest network of telemedicine clinics in Pakistan. We have 38 clinics across the country in all 4 provinces. We're the first company to be awarded a tender by the government to convert basic health units in the province to be telemedicine centers by a private company. We also have the largest corporate base in the country. So we serve 410 corporates today in Pakistan. So Philip Morris, Coke, companies like Unilever, 2 biggest banks, 2 biggest telcos are all our customers. We work with 3 insurance companies to provide services to their corporations. And because of that, we've had almost 950,000 users on our app and over 1 million consultations on the platform. Our GTV has grown exponentially in the last 8 months post-COVID, because COVID gave us an opportunity to expand and increase our growth. And we've grown 325% between Q4 last year to Q1 this year. And inshallah, we'll hit a 10 million GTV in the next 12 months. Next slide. The technology is extremely simple to use. So technology, we've created a technology that suits every kind of user. So an individual consumer can come to a platform. A corporate user can use it easily. For all our corporate clients, we have an admin dashboard, a live interactive dashboard where they can see how their employees are being treated, what are the top 10 diseases that are happening, what are the doctors that are being used. And then we have a very easy to use interactive intermediary module for our clinics. We also now integrate our app into third-party applications. So we have created the B2B2C vertical, which allows a deep integration within a banking app or a lifestyle app to make sure that we can gain maximum customers from different sources. Next slide. So Sehat Kahani has been active since the last 5 years, but owing to our growth in COVID, we've had an accelerated journey over the last 8-9 months. So now we're converting Sehat Kahani from a digital health tech platform to a digital healthcare super app. We already do virtual consultations, e-diagnostics, but we've launched e-pharmacy as well. So a patient can book their lab, the phlebotomist can come at their homes, or they can go to a designated branch and get their lab done or their diagnostic procedure done. We deliver their pharmacy at home, initially in my own city, and now we'll expand out to 3 or 4 other cities. We're also creating a vertical of home healthcare so that elderly patients or specially able patients or disabled patients can get healthcare at home. And we're also integrating premium healthcare for difficult specialties such as oncology or blood-related disorders, for which you do not find doctors that easily in Pakistan. It will be priced a little higher, but it will have an active user base of customers who want these difficult specialty doctors again and again. Next slide. And if I can talk about the growth history of the company in terms of funding, so Sehat Kahani has been blessed to work with a lot of partners, donors, investors till date. We've raised a funding of 3 million till date, out of which 1.8 million has come through equity investment and a 1.2 million has come through grant and donor funding. Spring Accelerator, Robert was talking today, so they were our first official funder. We were part of Spring Accelerator in 2017. And over the years, we've raised from equity investors, from USAID, from Palladium, through the help of IX to help us reach our seed and our pre-series A round. Sehat Kahani was also the first female-led company in Pakistan to raise a pre-series A round of $1.2 million. And now we're raising a series A round of $5 million, which we hope to complete within this year. Next slide. And I think this I will end with, because I believe that I was a medical doctor. I had no formal training to be an entrepreneur or a businesswoman. And I was 26 when I started this company, leaving behind a career as a clinician. But I think these networks and the funders, especially Spring Accelerator, that taught us very, very importantly, human-centered design. So that's the first time we put a separator in our clinics between the waiting room and the consultation room. And we did a whole research where we found out that women are uncomfortable when their relatives are waiting in the waiting room. So I think things like these we learned from accelerators such as Spring, such as I2I, such as USAID, such as working with Palladium, and many others that we work with over the years. So I think everything from financial modeling to bookkeeping to understanding product market fit to customers, business planning, investor preparedness. I think IX spent a huge time with us last year, making sure that we investor ready and pitching to the right kind of investors with the right pitch. So everything I've learned as a process, and I think these networks and these foundations and these accelerators have been a school for me over these years. So I'm very happy and very proud to be where me and my co-founder are because of because of the technical help, not just the funding help of the accelerators and the program that we've part of. Next slide. So where is Sehat Kahani moving now? Well, from a female doctor who started the company alone to running a company of 250 people today, I think that Sehat Kahani can become a super app that not only serves patients in Pakistan, but also in neighboring countries where there are other health challenges. So countries like Bangladesh, Nepal, the Southeast Asian region, the East African region, all suffer from health challenges. And we believe that we can play a very important role. So we are on our way to launch our first regional subsidiary in Sri Lanka, hopefully this year. And the vision in the next 5 years is to at least provide our services to 10% of Pakistan, which makes around 17 to 20 million users, and create a GDP of $262 million. But that's all numbers. I think as a founder, I want that every person in Pakistan, and even in the countries that we launch from now on, if patient needs a doctor at a primary healthcare level, Sehat Kahani should play a role in providing that doctor and that quality healthcare so that we can stop their diseases at a primary healthcare and help it not to progress to a secondary or tertiary care level. So that's from me. And apologies if I took more time, but I really wanted to spend a little bit of time presenting our work at Sehat Kahani. Thank you.
Great. Thank you so much, Dr. Sarah. Very, very impressive. And I see Jonathan's turned on his camera and unmuted his mic, so I'll invite him to join the discussion with you. Thank you, Jonathan.
Thank you, Dr. Sarah. That is truly a remarkable journey you've had. Good morning and good evening, everyone. I'm Jonathan from IX, and I lead the Impact Partners platform, which is the largest private placement platform that connects enterprises to impact investors. So Sehat Kahani is one of the enterprises that has benefited from our platform in getting access to capital and technical advisory support. At Impact Partners, we echo IX's overall mission, which is to create more inclusive and resilient communities by putting beneficiaries, primarily women, at the center of the conversation. Through our efforts, we've been able to unlock USD 250 million on our platform and impact over 100 million lives, thereby advancing 13 out of the 17 UN SDGs. So how do we echo IX's overall mission at Impact Partners? The way we do that is by mobilizing capital and mainstreaming impact. And in the process, we connect the backstreet of the underserved community to the Wall Streets of the world. At Impact Partners, we look to be the bridge between investors and impact enterprises through our platform and services. At Impact Partners, we provide investment readiness support. We help enterprises to be at a strategically at a place where they want investors to be at, and also deal structuring and introductory support, where we provide investors with access to highly screened and highly tailored opportunities from both operation and impact perspective. We assist in structuring the investment and providing good strategic investors that share their mission. We are highly selective with the companies that we take on. Each company goes through a rigid due diligence process that is mostly digital to assess the performance and impact. We have a digital tool that enterprises go through. If you see in the slide, that's the process which enterprises go in the slide. Firstly, the enterprises go through a screening process, which is from a traditional business perspective. Is the company scalable? Does the company have extensive track record? Do they have a solid management team? And do they have a proven business model? Once the traditional screening is done, we do the acclaimed IX values, which allow us to verify their impact and which they create in their communities. IX value addresses like, does the company impact women? Do they impact underserved communities? Do the outcomes align with IX's mission? And is the impact scalable? With COVID-19 changing all our lives, finally, we screen the enterprises for COVID-19 resilience using our online survey, allowing us to determine the effects of the business. How are they serving underserved communities? Do they diversify their risk? How does the focus on deep impact allow the company to pivot? Once the 3 screenings are completed, and if the enterprises are eligible, we send the enterprises engagement letter to engage with us. As mentioned before, Sehat Kahani is one of the success stories and a true testament of the resilience within uncertainty. Now, I would like to ask Dr. Sarah a few questions regarding your journey and how it has been. I will shoot them across right away. So, Dr. Sarah?
Yes, Jonathan.
Yep. So the first question is, Sehat Kahani is one of the leading meditech startups in Pakistan. How did you overcome the challenges in breaking the stereotypes, particularly as a women-led startup and as a country where capital flow was limited to startups when you started Sehat Kahani?
Thank you, Jonathan. I think, as I mentioned, I started my journey as a doctor turned entrepreneur with a baby. So I think it was initially very difficult. There were very limited female-led companies when I started. There are even very limited female-led companies now. Even in 2021, only 0.2% of total funding that is raised by Pakistani startups, women have been a part of 0.2%, which is not that different from what happens globally. But I think I faced a few challenges that I just want to mention here. I think people in Pakistan typically belong to a conservative patriarchal mindset. So it's not easy for them to see women in a leadership position. I still remember not too long ago, I entered into a meeting in a corporation and I was asked to bring someone elder to me in the meeting next time because they thought I was too young to represent a big company. I think in terms of raising investment, initially, when we were pitching to investors for our seed and our Series A round, I think we found some hesitance for their trust in female founders. I think it's something that my fellow female founders from Pakistan can relate, that there is an uncertainty and there's a certain risk associated in the mind of maybe investors that a Pakistani female would either leave her work or give it up because of children or family responsibilities, or would not be able to handle financial management. There are some risks and taboos associated. But I think now that we're raising, now that we've progressed into our funding rounds, I think we've overcome that taboo or that preconceived notion. Now, when I talk to investors, I think the work and the impact that we have speaks for itself. So definitely, it's challenging being a female co-founder team in Pakistan. I think a lot of times we feel that even the men in the meeting room feel more comfortable talking to the men in our company rather than talking to us. But that's something that we've overcome with a lot of hard work, with a lot of confidence when we go into the meetings. And over time, I've realized that once you enter into the room, I think you need to leave your gender behind, and that's the only way you can progress and you can tell people about the work you do.
Thank you, Dr. Sarah. So kudos to you for being a role model for all the young female entrepreneurs out there in Pakistan. So well done. So the second question, what are the key challenges you foresee in the future which can hamper Sehat Khani's growth? And how do you expect organizations like IX to assist you to face these challenges and successfully overcome them?
So I can talk about the Pakistani entrepreneurial ecosystem. I think it's pretty nascent. We've had a great last year, but majority of the investment by the larger VC groups was in the e-commerce or in the fintech sector, obviously because it's a growing market. We are yet, and I think there's still a little hesitance in international VCs investing in health tech in the emerging market. So I think one of the challenges that we see as the market now is showing less liquidity and there's tough years ahead for all startups and all young companies, I think the challenges that we see is related to funding and growth because we are at an inflection point in our company where we need to go quickly to have maximum traction. So I think depreciation in good funding opportunities, good investors is a challenge that we see at the moment that can hamper our growth. I think all the companies, including us, are reevaluating and refiguring our financial situation and making sure that we last for 3 years. So I think how companies, organizations like IX can help companies like us is strategizing how we can maximize our runway and really find the right kind of investors at the end of the journey who understand impact for companies like Sehat Kahani and understand growth the way we see it. So for us, growth is an extremely important factor, but impact is crucial to our work. So, how you can help us is, help us figure out how to lean the hard way, how to pass this difficult time for the companies ahead in the next 2 years. And then at the end of the road, find the right kind of people who can help us then grow at the right time and at the right pace.
Thank you, Dr. Sarah. I'm not, yes, I'm not quite sure
So
whether we've
Jonathan, I'm not
overrun our
going
time.
to, yes.
Yeah.
I had a couple
So
of questions from Jonathan, but if you have the time, I'll quickly ask them. Stephanie, if you allow.
Yes, absolutely. I think we do have a few minutes. We have about 30 minutes left and a few questions in the chat, but it would be great if you two could proceed and then we'll take questions from the audience as well. Please go ahead. Thank you.
Thank you. So I think I briefly mentioned that, we met IX whenever we were raising our pre-series A round. And I think the whole team was very useful in investor preparedness, in measuring our impact, and also helping us raising funding from angel investors. So as a company who had support of IX, I had a few questions from Jonathan so that other companies can also find benefit in your process. So I think, Jonathan, my first question is, how do you measure impact for the companies that you support? And are there any specific tools that you use for the process?
Yep. So thank you, Dr. Sarah. That's a very valid question. So if you look at impact, as you know, IX really works with the grassroots level people and organizations or companies in the developing countries. So we've worked in the impact space for the last 9 years. And one of the key tools which we've developed and which Sehat Kahani also has used is the IX values program, which actually measures the impact, which we actually verify at the stakeholder level. So it's not just an online tool where you just fill up a questionnaire and the impact is just verified. We actually check with the stakeholders, the customers, the suppliers at grassroots level, whether they're actually making the impact. So that way we are actually onboarding companies who we actually verify the impact, and that way we can curate the results as well. And now we've gone one step ahead by incorporating our values program and incorporate the languages as well in some of the countries so that we can also touch the grassroots level entrepreneurs and stakeholders as well, because language is one of the key barriers as well. So that's also one of the tools which we're using so that we actually verify the impact and we are able to communicate to our investors as well and give a very solid report which they can actually trust, not just a online questionnaire which can be filled by anybody.
Thank you, Jonathan. I think I've used that questionnaire, and at the end of it, we were able to produce very impactful data for the quality of the services that we were providing at Sehat Kahani. I still remember that exercise we did last year. So my second question, and it's very important because I went through the process, and a lot of companies struggle in finding the answer to this. How do you actually help a young company raise funds, and what happens in the investor preparedness? And what role does IX play in that, helping a young company or a young founder who's not that ready for investor discussions or negotiations?
So for any company who we onboard, we don't take them in front of investors until we make sure that they're investor ready. Because now we've been in the game of making enterprises investor ready for about last 10 years. So we actually know what the investors really want. So we actually make sure the enterprises, their pitch decks, their teasers, their valuation models are justifiable. So just because a company comes up with a 10x valuation, we don't just take that to the investor. We actually verify whether that and whether it makes justifiable for the investor, because that puts us in a bad wicket, plus the enterprise as well. So we actually make sure that they are investor ready, and also especially on the impact angle as well. So these days, I think lots of funds are talking about the startup capital narrowing down as well. So we actually tell them that you need to not only talk about the financials, but also need to talk about impact angle as well, which will also make sure that they are able to raise successfully and also reach a wider audience, which are normally not available to other enterprises which are raising capital.
I think that's very true, and I remember some tough conversations that we had on investor preparedness with me and our finance person. I think lastly, I just want to ask that, is there any other areas that you help young companies with? We've discussed too, but anything you want to mention? And if a young impact company wants to apply to the program, what is the method and how they can seek your help?
So basically, the process is very simple. It's just purely online now. It's purely digital. So you just sign up on our platform, and it's all automated. Our platform picks out the impact enterprises or enterprises who make the cut easily, because we've automated it through AI, and now it automatically comes to our team. So we actually place a great emphasis on impact, because currently we just don't make it a fancy word that impact is just something to put the icing on the cake. We actually make sure that impact is really key, because if you talk about the current world, there is lots of VC funding getting narrowed down, but actually we see there's lots of impact capital still being available, especially for impact enterprises. But when you look at a normal startup, it's only VC capital which is available. But when you look at an impact enterprise, you're not only availing yourself to venture capital funds, but also to foundation capital and also other angel capital as well, who's looking to invest in that space. So impact is not just a fancy word out there, but it's just an important factor for enterprises' success.
Thank you, Jonathan. I think that's incredibly helpful, and I think you've toned it down to the right sentence, that impact is not just an icing on the cake. It's actually something you need to strive for when you're building a product or a service. Thank you. So that's all from our side,
Yep.
Stephanie.
Yeah. Thank you, Dr. Sarah.
All right, great. Thank you both so much. Really insightful discussion, and thank you to all the speakers. The enterprises, huge congratulations. Your success is so impressive and inspirational, I'm sure, to many on the phone and many others who will receive the recording of this webinar in the forthcoming publication. So at this time, I'd like to ask all the speakers to turn their cameras back on and come off mute to join us for a question and answer session. We have had a couple of questions in the chat. I was just about to invite Kuyush, who asked that first question, to come off mute and turn on his camera and join us. He's had to leave, unfortunately, but we can, for the recording, definitely ask that first question. And I think that was posed to Kasha around the trust issue, regardless of product offering at Kasha's platform. Thinking about family planning products that usually require additional detailing promotion with facilities and outlets to affect the uptake through any platform versus the fast-moving consumer good products. If you could just speak a little bit, Natasha, about that question, it'd be great to hear from you. Thank you.
Yeah, thank you. And I think when it comes to trust, I think the issue we had was not vis-a-vis the products. It was more on the platform itself, because there was Kasha was one of the first e-commerce platform at that time, so people are not familiar with the platform, and they understand how can you buy a product without having it in your hands because they were used to shops, and that was the issue, the trust, and that's what we did. We worked on with the Spring Accelerator program actually to understand why and understand how do we solve this. To think about the family planning products, I think that is true. We do have on our platform. We do have different contraceptive methods, and the reason why we have even the short and the long-acting contraceptive method, which most of the time require a clinician or healthcare provider to start it. And one of the reasons we have those is that one of the things we need is to actually provide options for women. So products does not necessarily mean a product, it can be information. And so what we're trying to do is having all those options and ensuring that women understand how can you get this product. So if it's a long-acting method, how do you get it? And we have partners clinic that we trust, that we have having trainings with them, that we know that they'll provide a confidential service. And what we do is to refer. So we explain the whole process of referring, and we make it more convenient for the women. So we make the appointment, and that is actually what we want to do with those products, because we know as a model, we're not going to be providing those methods that need the clinician to and the user to be in person. What we do is just to that linkage, and for us, it's actually something that is very, very important for us to be able to provide all those options for women. And they have definitely been quite an interesting and uptake, because if we are introducing a product on our platform, then people get to ask questions to the nurse, and they might take that option because they have had the opportunity to look at the information, but also have someone to ask specifically. Thank you.
Could I jump in to add, because of course that was one of, let's say, our initial learnings, or things even at the end of spring that we were kind of synthesizing as a learning. But you know, that's something I've continued to see over the past 2 years since spring ended, in terms of other businesses really taking on some sort of agent type model, you know, whether it's an ambassador or someone, because I think especially when you're dealing with marginalized communities and you know, folks that perhaps don't engage technology a lot, there's just a continued need to have some sort of more personable connection to build that trust. So yeah, I think Kasha, you've been kind of pioneering that model, and I think it continues to demonstrate lessons learned for other businesses.
Yeah, thank you. Thank you both. So we're a relatively small group. I see Lauren has put a question in the chat. Lauren, if you do want to come off mute and put your video on, we'd be delighted to have you ask your question directly. I think both the speakers, or all the speakers, really have touched on points of this, but it would be great to hear more. So would love to have you join us. If Lauren is still there and can, I think Zach, you may need to unmute her too as well. Yeah. Zach,
okay. Hi. Yes.
Hi. Thanks.
Hello. Greetings from Nairobi, and my bandwidth is not great, so I'm not going to put my camera on. Apologies for that. But first, Natasha and Dr. Sarah, thank you so much for sharing your entrepreneurial journeys. Really and incredibly impressive. Can imagine the resilience it took to get from where you started to where you are today. And I'm wondering, I'd like to hear a little bit more about sort of, and Dr. Sarah, you started this talking about, you know, being a physician, right? Not a person who had an MBA and went to business school and having to learn financial modeling and the term, you know, product, you know, customer product fit, et cetera. So I'm wondering if maybe you could get a little bit, both of you could get a bit more granular and specific about some of the most critical sort of pre-launch, you know, advisory support and finance you needed and didn't get or did get, and post-launch, maybe a little bit digging into kind of when some of the most critical needs arose. Yeah, Dr. Sarah, maybe if you would start.
Sure. Thank you, Lauren. I think I can go a little bit deeper. So very interestingly, I had all this. So I never participated in incubator or a pre-launch phase program, because we launched the clinic, and after launching the first clinic, that is when I realized that this had a potential after we piloted it, and then we started writing the business plan. But I think my first ever engagement with an accelerator was the Unreasonable Institute in Washington, D.C., and I couldn't participate physically because my father was ill at a point. So I still remember one of the advisors used to get on a call with me. And I'm embarrassed to say this, but at that time I didn't even know how to work in Excel, because medical doctors have nothing to do with numbers and finances. That's something you never learn. So he very patiently, through 3 hours session in a week, taught me the basics of financial modeling, and I think I owe a lot to him. But I realized as I grew that unless and until I knew the basics of everything, I won't be able to function or create a company or grow. So I learned the basics of financial modeling, learned the basics of business planning, strategy, HR planning, and participated and made myself available for many learning opportunities, such as, there's an accelerator in Pakistan called I2I, who has these weekends where they take you to another destination, and they teach you about product market fit, customer profiling. And I really made sure that we took out time and took learnings in from these programs. And I think those first 2 years where I participated in different programs and made myself available to learn about different modules, I think really impacted my journey as an entrepreneur later on. So something like HR planning. This is a very crucial part when your company start to grow between 10-15 employees, and I had no idea on how HR planning or organizational development works, and I did a special course to understand how does organizational development and HR planning and growth can impact your company or your startup. So I think little bits and pieces of learning and then turning them into practical knowledge and a lot of trial and error as you grow as an entrepreneur really helped me. But I'm also very grateful to programs, again, like Spring Accelerator, who taught me the value of human-centered design, something that I learned when I became a part of the accelerator. And that helped us on the ground with a lot of techniques that we were applying to in our clinic. Similarly, we took a part in GSMA Accelerator, which was associated with funding as well. And they really helped us understand the value of technology. So there I learned the basics of building an application. So today, if you ask me, I know all the basics of building applications, front end, back end, to the point that sometimes when I'm talking, people laugh at me and say that you don't look like a doctor, you look like a tech person now. So it's really, I think the information is provided by all kinds of programs. It just depends on how much you can grab and absorb, and what are the areas of your interest that you can grow into. But I think information is available all throughout. It's just for you to learn whatever you want to. And also, I think one thing that happened with me that I just want to mention is because of these programs and the funding support, something that we really miss out is I was able to maintain my equity. So now when I raise my Series A round, me and my co-founder have a lot more equity as compared to my other female and male counterparts who don't have a lot of equity to give away and somehow lose control on their operations. So that soft funding in the first couple of years helped us run operations, expand, and not to lose that early equity, which we now can preserve for good investors or more strategic investors into the business. So I think that's also a very big high that I think is not talked about that much for early stage businesses.
Yeah, fantastic, Dr. Sarah, and thank you for making that last point in particular. Lauren, I don't know if you were going to jump in. I was going to allow Natasha to also perhaps respond and provide any more depth on your initial question, but feel free to jump back in as well, Lauren.
No, that's exactly what I was hoping for. Natasha, I'd love to hear a bit about the, kind of exactly when and what types of support were most useful or missing that you didn't get in the market, and what you'd like to see, entrepreneurs coming behind you right now. You've kind of made it out of that valley of death, right? So what would you like to see for early enterprises in Rwanda, in Kenya, in your markets, so that their journey is not quite so arduous?
Yeah, I mean, thank you. Unfortunately, I'm not part of the co-founders, but I've joined the company earlier, so I can talk about what I've noticed is that One of the things as an epidemiologist, for me, getting into investing and funding world was challenging, as Dr. Sarah. The terminologies, I remember when I saw BDS at the time, I was like, what is this? What is this? I couldn't even figure out that this is just business development strategy. But like she mentioned, there are so many opportunities in terms of learning. But what I've noticed in terms of investment is really not, because you want many investment and funding that are sometimes you might forget that you need to be strategic in a way that if you want, for example, something to be able to expand, you need more investment there looking at operations versus investment that just going to come, or funding that just going to come with activities and just implementing. And that what we do to you is that you're going to have a lot of human resources that we just work on activities, but not necessarily expand your work. And that has been, I think, one of the challenge. But now at least the Kasha is now really positioning itself to know who is the best investor and funder that actually can be more sustainable for the company. And I think that's what we are striving to, is to ensure that if someone invests in the company, we ensure that the work we are doing will actually be sustainable and doesn't end with the funding or the investment. Thank you.
Great. Thank you. Thank you both for your responses. Robert and Jonathan, I don't know if you have anything you want to add to that from your perspective, supporting these organizations. Otherwise, I'm happy to pose one of my questions as well now.
Yeah, I'll jump in because felt like, Natasha, you were ending with another key point that I'm passionate about in terms of not only how are you as a business struggling with obtaining funding and then continuing to grow once that funding stops, or the BDS or the grant funding, as you may call it. I think another key issue in our industry is how the intermediaries themselves are also doing that. So, I like to point out that it's a key learning from Spring that I think as we set up these intermediaries, these blended finance mechanisms, these donor-funded programs, that we think about it as something that has longevity, has kind of a market viability as a mechanism, right? So we really have to focus on that and how we're changing the way in which the grant funding is being supplied to market, so that we are sensitive to that. And because I think we've seen a little bit of some things getting distorted in market with grant funding. And so the way in which you provide that grant funding at the right time and through the mechanism that is really part of a kind of sequence of solutions is really important.
Yeah, so sorry.
Go ahead, Jonathan.
So some insights from my side is sometimes when you look at funders, they always look at growth. So, but always, I think from our perspective, I think some of the organizations, of course, have to look at, as Robert just said, longevity. So basically sustaining yourself on the long term as well, because if you see now there might be a dearth of funding, but how do you actually manage your runway on the long term and manage your cash flow? It's not always on the profitability as well, but also on the cash flow, which is now coming into a very important stage because there's low requirement of funding and low funders are basically limiting their capital. So how do you sustain your runway is also one of the key things. So we work with a lot of enterprises in making sure that they actually sustain them for the long term, not just showing high growth rates just to sustain for 2 years, but actually the impact and enterprise is scale on the longer term.
Great. Thank you, Jonathan. You were cutting out at the end there, but I think you're bringing up a really important point around impact and the role that both Spring and IIX have played in helping investors see the importance of impact. And I think this is probably unique to the health sector, in contrast to other sectors you probably support. So both Spring and IIX help enterprises in other sectors. And I'd just be curious to hear really from all of you how you think the health sector is unique, how it's perhaps more difficult, but what is the type of support or considerations we should be thinking of when we're thinking of health enterprise support. You've mentioned obviously on the HR issues, you know, founder doctors and nurses may not have that HR financial experience. But in terms of raising capital for the health sector, you know, how can we do that? Because it's not as grown as quickly, I think, as perhaps in other sectors. So just looking to hear some of your perspectives on that as well.
I think I can start. I think one of the things about health sector is it's not a commodity. Health is not a commodity. So health is not food, or it's not clothes, or it's not a product you can buy from a shop. There's a lot of trust factor. There's a lot of customer stickiness required that happens over time. And entering into health tech is changing health behaviors. You can only manage anything which is related to early stage health tech, which is most health tech companies are focused on, or the health tech companies on primary healthcare, is where you have to change behaviors and educate people why menstrual health is important, why early stage primary care is important for them to alter their life journey or their well-being. So I think a lot of educating the customer is required. There's also a huge digital divide when it comes to healthcare in countries like Pakistan that I can say. So, for example, only 14% of women in Pakistan have smartphones, which ultimately discredits them from all financial inclusion policies, from accessing healthcare on their own. They're still very dependent on their husband or the primary caregiver that has the phone in the house. So it is a difficult service or a product to show growth in the earlier years. But I think one positive that people don't really talk about is that the gross margins that I've seen in health is much more than other sectors, for example, e-commerce and fintech. So I think where we do struggle with showing early growth, the good upside is that there is higher gross margins as compared to other sectors, which can be utilized for sustainability. So I think the health tech sector should be seen from an angle of profitability and sustainability, and not just growth and growth numbers, which is what I feel as a founder working in this industry.
Yeah, that's fantastic. Thank you. Kasha, looks like you'd like to jump in there as well.
Yeah, sure. And maybe what I can add, which I agree with her, that the time to understand the behavior to change takes more time than any other product. But also one of the things I've noticed is that rules and regulation in countries are also not that open. So it takes time. I remember we had, before COVID, we didn't have any, in Rwanda, any online pharmaceutical regulation. And it came out when we actually had other pharmacies were like, oh, we need to have laws and regulation around this because customers now need their medication more. But at that time, it has been more than 3 years that Kasha was operating. So now it became a discussion and we started working on them, but it had to stop for more than 5 months. Also, that shows some of the things that this industry is also very different compared to the normal other products. But also, I think when it comes to what you provide and the product themselves, there are so many, especially in the pharmaceutical world, there are so many changes and fluctuation prices compared to the other industry, honestly. And I think that is really one of also the challenge that we consider when you're operating this. Yeah.
All right, great. So we just have a few minutes left, and maybe a follow-up question that my colleague Sayaka has put in the chat. And in the interest of time, I'll ask Sylvia from USAID Center for Impact and Innovation to join us on video and unmute herself. Her question is around how USAID, as one of the donors, is shifting its approach to funding entrepreneurs, and perhaps funding entrepreneurs as well as entrepreneurial support organizations such as Spring Accelerator and IIX. This goes to, I think, also the core of their business model, which Robert was talking about a little bit as well, for the entrepreneurs themselves to pay for that type of support versus grant or philanthropic capital to allow their business models to function, so that we have this really healthy ecosystem of entrepreneurial support, and in particular in the health sector, which we know is challenged for the reasons we just spoke about. So Sylvia, it would be great to hear from you. Over to you.
I'll try to address that question as best as I can. So traditionally, as you all know, USAID has and gives grants, and the way that we've been trying to change that with blended finance and innovative financing and mechanisms is switching that grant for just, for example, for technical assistance and just landscape assessments to really using as a catalytic form of crowding and private investors, but mainly in a de-risking tool. So as we've seen it, and the way that I've seen it be used since I've been at USAID has only been as a de-risking tool, and that's mainly because of all the USAID is not in a place to do any sort of equity investments, and because of that, the only way that we've been using it is de-risking. So we've done that with the Tanzania activity, and we're potentially doing that in a Bangladesh activity. And so with entrepreneurs, we've also had grant challenges, and they've used the grants to support the grant challenges, and that's the way that that's been used to scale up some entrepreneurs. But again, that would just be grant-based funding. And again, we cannot do equity. So that's how USAID is trying to step into that role of crowding and private investments. And so to summarize, both with a de-risking tool and guarantees and grants. Hopefully that answers your question.
Yeah, I think that's great. And I think we could have a much longer follow-on discussion too about how that kind of capital and support could factor in with support from other finance institutions as well. And that could be perhaps a follow-up webinar. I think some of the other things we didn't get a chance to discuss today are around the broader enabling environment, such as regulation and how that plays out in the digital health space, for example, and impacts growth. But we'll save those questions and discussion for another time. We are at the top of the hour, so I just want to give a huge thank you to our very impressive and inspirational speakers today. Thank you for giving us your time and sharing your stories, and to all those who joined online and for your questions. And finally, to my colleagues at Palladium who helped pull this event together and produce it behind the scenes. Thank you, and hope to be in touch with all of you again soon. Bye-bye.
Thank you, everyone. Have a great night. Bye-bye.
Bye.